Greetings from Group 3. My name is Glenna Cernuska. I will be presenting with Jane Hoff and Jolie LaRue. Our topic is ethical considerations in conducting research with special populations, including children, pregnant women, and employees. Our objectives: define vulnerable populations. The DNP student will recognize ethical issues that can occur in research in children. DNP students will identify strategies to obtain informed consent in children. DNP students will examine ethical issues that can occur when recruiting employees for a research study. The DNP students will assimilate research recruitment strategies for employees that are free of undue influence and coercion. The DNP will assimilate research recruitment strategies for employees that are free of undue influence and coercion. The PN student will identify the evolution of pregnant women as a vulnerable population in research. And the DNP will summarize the 10 regulations that govern research on pregnant women. So what is a vulnerable population? Vulnerability occurs when a person's ability to protect himself is absent or diminished. Vulnerable populations are more susceptible to both intentional and inadvertent harm. The federal government has established guidelines and regulations for the protection of vulnerable research subjects, which include children, pregnant women, cognitively impaired persons, prisoners, students, residents, and employees. The first topic I will present is research with children. The first thing we're going to talk about is obtaining consent with children. Children are persons who have not attained the legal age for consent to treatments or procedures involved in research. U.S. law considers any persons under 18 years of age a child. Involving children in research raises ethical concerns because their autonomy and competence to give informed consent is less than that of adults. Their participation is necessary to develop new treatments and prevention methods that will benefit children and protect children from harmful practices. Consent with children, one parent or two parents. One parent consent is needed only necessary if there is minimal risk for the child. If it involves greater than minimal risk for the child, but it could benefit the child. If one parent is deceased, if they are incarcerated, if they are not reasonably available, or if one parent has legal custody. Otherwise, parental consent is required by both parents for all other categories of research. Assent or approval versus dissent or disapproval. Should you ask children if they want to participate in research? Yes, if they can comprehend and appreciate what it means to be a volunteer for the benefit of others, it can be very rewarding for them. If the research could directly benefit the child, assent is not required. Dissent or disapprove should be honored if the child at any time wishes to withdraw from the study. Should be honored. Risks to the children. IRB must determine the risks and potential benefits to the child and society. There is no consensus on what determines minimal risks. Federal regulations do not describe the assent process. It is up to the investigators to design a process consistent with the child's decision-making skills. Providing information to children. You have to make sure the information is age appropriate, if it is easily understandable for the child. It must be tailored to the child's emotional and cognitive maturity. You should minimize distractions, provide a quiet environment, and you can also utilize a toolkit to enhance the informed consent process, which includes the use of visual aids and the teach back method. about payments? Payments must be of an amount that minimizes the possibility of unduly influence of the parents. Consideration that can be paid are travel expenses, meals, parking, babysitting, and perhaps time off work. A large cash payment is inappropriate. Small gifts, however, are acceptable. These may include gift cards or a stuffed animal, toys based on a child's age. Next, I have a case study. TJ is a 7-year-old boy who was diagnosed with asthma at the age of 3. His asthma is of moderate severity and is well controlled with his medications most of the time. However, he has had occasional 2 or 3 times a year exacerbations requiring a visit to either his physician or the emergency room. Otherwise, he is healthy, attends school regularly, and participates in age-appropriate sports. TJ's asthma medications include the daily use of a corticosteroid inhaler and the use of a bronchodilator as needed for worsening of his asthma symptoms before physical exertion. TJ and his parents have been approached about participating in a study of a new medication for asthma to assess its safety and efficacy in treating children with asthma. This medication is taken as a flavored chewable tablet once daily by mouth and works by a totally different mechanism than the inhaled medications TJ is currently taking. And it is a blind study. It has not been studied in children yet. However, 3 studies have been completed in 550 adult patients with asthma. And the preliminary evidence from the adult studies is that the new experiment does improve asthma in some patients and has very few side effects. The side effects so far in adults have been limited to occasional nausea, headache, and dizziness. So here are some questions for thought, which you may want to consider when you respond in our discussion. What are the possible risks, if any, to TJ if he were to enroll in this study? What are the possible benefits, if any, to TJ? What about to other children with asthma? What are the risks of not including children in research? Since TJ is only 7 years old, he is not allowed by law to independently consent to medical care or agree to be in the study. What right do his parents have to volunteer him to be in a clinical trial? And what are their responsibilities if they choose to do so, or if they choose not? What rights does TJ have? Should he be able to volunteer on his own, even if his parents refuse their permission? And should he have the right to refuse even if his parents agree for him to be in the study? Can it be ethically justified to withhold medications from a child for conducting a study? What if the use of placebos is ethically justified in research involving children? If so, under what circumstances? And if TJ were your child, would you give permission for him to be in the study? This concludes my part of the presentation. These are my references, and Julie LaRue will now present vulnerable population of employees. Thank you very much.
Hi, my name is Julie LaRue, and I will be discussing ethical considerations in conducting research with employees as participants. Employer-based research is research using employees as participants and may be conducted on, but is not limited to, employees at colleges, universities, medical centers, and private companies. These are only examples, and there are many other types of employment that may entertain some type of research study that is employer-based. The research study may be low risk, such as a survey or biological sample collection with protocols, but could involve a riskier study such as clinical trials. Employers or employees who participate in employer-based research may be employed temporarily, per diem, full-time, part-time, or visiting faculty, or even fellows. There are various types of employee participants in employer-based research. There could be studies open to all employees who meet inclusion criteria or studies that target employees, such as research that is conducted on the effects of morale within a workplace, or research studies that is conducted for health risks related to some type of occupational exposure. Employer-based research can be beneficial for society. However, it can also pose ethical concerns for the working employee. I'm going to provide you with 2 examples of ethical concerns that have occurred. A report that was published in 1989 called Nonprofit Environmental Working Group concluded in the 1980 and 1990 that there were companies that conducted risky research on their employees by exposing them to high-risk pesticides. Also, there was a ethical concern that occurred at Johns Hopkins University where an employee, Ellen Roche, lab technician, died from inhaling hexamethonium in an asthma study. The study was conducted on healthy employee volunteers who received monetary stipends and a day off work for participating. The United States Office for Human Resource Protection faulted the researchers for not investigating literature on the dangers of inhaling this drug. There are no specific federal regulations governing research with humans that deem employees as a special research participant category that requires extra protection. However, employees are considered vulnerable due to the susceptibility to coercion and undue influence when recruited for employer-based research. Employees are vulnerable when participation in employer-based research study is perceived as required to prevent loss of privileges, benefits, opportunities, or job advancements that is associated with one's employment. Therefore, federal regulations and ethical guidelines require various safeguards to protect rights and welfare of vulnerable participants in research. So to define employees' vulnerability, there are concepts. Undue influence and coercion are the 2 most popular to define employees' vulnerability. Undue influence involves taking advantage of someone's weaknesses or vulnerability to induce him or her to make a particular decision. And there's 2 types of undue influence. Manipulation, which is influencing a research subject's decision by altering the available options or information. And the second type of undue influence is persuasion, guiding a research subject to your way of thinking through the disclosure of truthful information, but in a manner that is meant to get a person to think or act in a preferred manner. And the other concept is coercion. This is the force, threats, or intimidation to achieve compliance. Examples of undue influence or coercion. Well, a supervisor can approach an employee and intimidate them and pressure them into enrolling in the study. Second example of undue influence or coercion is a supervisor could offer employment benefit, such as a promotion in return to participating in the research study. And third, the employee's indirect supervisor pressures the employee to participate or may instruct the employee's supervisor to take steps to ensure that the employee participates in the study, causing the employee to be afraid and enroll in the study out of fear and retaliation. Fourth, co-workers interact with other employees and pressure them to enroll in a study. There's ethical concerns that can occur in employer-based research, and that's informed consent, privacy, and confidentiality, as well as bias. It is important that the employees make a free and informed discussion regarding participation. Regulation and guidelines for research require informed consent should take place under conditions that minimize the risk for coercion or undue influence and allow the choice of withdrawal from the research study. For example, a supervisor announcing in a staff meeting that staff need to donate biological samples for research study. This may make the staff members feel as though the employer might take action against them for not participating in the research study. And for privacy and confidentiality, research regulation and guidelines require that participants' privacy and confidentiality be protected. This is both physical and informational privacy that is required to be protected. Informational privacy and confidentiality are where any information that is learned about the employee should not be disclosed to other employees. An example of a violation of physical privacy is if you watch a participant undress without their permission. Now, bias can occur with an employee participating in an employer-based research and may become an ethical issue in a research involving human participants. In other words, the study's risk that is imposed on the participants should not outweigh the expected benefits to the participants or the society. An example where bias may occur is where employees may provide different answers to questions to research based on their employment because they are worried that their employer may find out if they answer questions about illegal or unethical behaviors. There's strategies that are recommended that employers should implement for employer-based research, and that is research proposals should describe measures that will protect employees. Informed consent and discussions should clearly state participation will have no impact on employment or benefits. Participation should be voluntary and free from pressure. Supervisors should not directly recruit employee participants. Therefore, they should be recruited through announcements and flyers. Training should be implemented for research staff to protect employee participants. Strategies should be implemented by investigators, institutions, and institutional review boards to minimize and control bias. And this can be done through development of recruitment strategies, survey methods, as well as ensuring confidentiality will be protected of the employee. Supervisor interaction with employee participants should be avoided. Employees should be given enough time to consider participating. IRBs should ensure the rights and welfare of employees are adequately protected as participants by reviewing literature on employee research studies. And of course, there should be some type of independent party should be consulted to be used for informed consent process. In conclusion, employees are vulnerable subjects and are at risk for undue influence and coercion. Ethical issues that need to be protected are informed consent, privacy, confidentiality, and bias. There are recommended strategies for protecting employees in employer-based research. I'd like to thank you for listening to my discussion on ethical considerations and conducting research with employees as participants.
Hi, my name is Jane Hoff, and I'll be discussing with you ethical considerations in conducting research with special populations, and we'll be discussing pregnant women. What I'd first like to do is discuss with you a little bit about the history as to why pregnant women were considered vulnerable. There was a problem back in 1938 to 1971 when physicians were prescribing diethylstilbestrone to women to help prevent miscarriage. Unfortunately, miscarriage was not prevented, but what did result was severe adverse complications in the offspring of the women who took the medications, including vaginal and cervical carcinomas in young women and malformations of the reproductive organs in both male and females. And then in the 1950s, another drug was given to pregnant women called thalidomide. And what happened there was also no prior testing on pregnant women, and it resulted in unforeseen teratogenic effects, which produced severe birth defects in over 10,000 babies. So neither of these drugs were involved in research, but they still alerted the research community, and pregnant women were considered vulnerable, and now researchers took on more of a protectionist approach, and that still exists today in clinical research. Continuing on with some of the research, in 2011, the Food and Drug Administration came out with a comprehensive list of all medications that they considered approved. Unfortunately, they were they were not approved for pregnant women. So despite all efforts, pregnant women were still underrepresented. 91% of these meds were approved by use by adults, but did not have sufficient data on safety, efficacy, and fetal risk if taken during pregnancy. Of course, this is a huge problem. The number of pregnant women taking medications have increased. 84 to about 99% of pregnant women today take meds for symptoms such as nausea, and they also take off-label medications. Some women are taking as close to 4 different medications, such as antibiotics, asthma meds, and meds for some depressive disorders. Also, another situation is that women that in the past were unable to conceive are starting to becoming pregnant, and they are on all sorts of medications, such as our severe diabetics, women with cardiac disease, lupus, thyroid disease, and seizure disorders, as well as our known marked increase in opioids for chronic pain, and the number of women also taking psychotropic medications. These women need their medications, yet many of these meds will need to be adjusted for pregnancy, and many do have adverse reactions to the fetus. So why do we include pregnant women in research? Well, there are over 60 million women in the United States between the ages of 15 and 44, and over 4 million births per year. Pregnancy itself has extensive physiological changes that occur, and it certainly will affect the pharmacokinetics and pharmacodynamics. Women need safe and effective treatment during pregnancy. Pregnant women need access to clinical trials that would not necessarily been available to them or their fetus outside of the research setting. Improvement in research in pregnant women will only improve population health. So, well, before we go discuss a little bit about the different regulations here in the United States, I'd like to discuss a little bit about minimal risk. Minimal risk is defined as the probability and magnitude of harm or discomfort anticipated in research is not greater in and of itself than those ordinarily encountered in daily life or during the performance of routine physical or psychological examinations or tests. We need to minimize the risk while still achieving the objectives of the research. Now I'd like to talk with you about some of the regulations that govern research on pregnant women. Number 1, making sure that there are non-clinical studies. Studies on pregnant animals and non-pregnant women have been conducted first to assess the potential risks on pregnant women and their fetuses. Number 2, risks to the fetus caused by the research has direct benefit for the woman or the fetus, or if there is no benefit, the risk to the fetus is not greater than minimal, and the purpose of the research, the development of important biomedical knowledge which cannot be obtained by any other means. Number 3, that any risk is the least possible for achieving the objectives of the research. Number 4, that there is absolutely a consent from the pregnant woman. Number 5, that if the research is a direct benefit to solely the fetus, then the consent of the pregnant woman and the father is to be obtained, except when the father is unable to be obtained due to unavailability, incompetence, or temporary incapacity, or if the pregnancy had resulted from rape or incest. Number 6, the woman must be fully informed regarding the unforeseen possible impacts of the research on the fetus or the neonate. Number 7, for children who become pregnant, assent and permission are obtained in accordance of the state law. In some states, a pregnant minor may be considered emancipated by virtue of her pregnancy. So the IRBs would have to comply with the state law and the applicable requirements of additional safeguards for children in clinical investigations. Number 7, no monies will be offered to terminate a pregnancy. Number 9, individuals engaged in research will have no part in the decision as to the timing, the method, or the procedures used to terminate the pregnancy. And number 10, individuals engaged in the research will have no part in determining the viability of the neonate. The viability will be determined by the obstetrician and the neonatologist. Some safety guidelines in the research for pregnant women. Investigators or consultants need to have expertise in obstetrics and or maternal fetal medicine. The gestational age must be determined during the research and taken into account, especially when giving different medications. You need to know how the pharmacokinetics and pharmacodynamics change throughout pregnancy depending on the gestational age. Prenatal care must be given to the women during the research. If in a research protocol, a woman becomes pregnant, then the woman will need to understand the maternal and fetal adverse events that could be reasonably attributed to the drug exposure and are deemed to exceed the potential benefits of the drug treatments. They should consider alternative effective treatments or withdraw from the research. Also, follow-up on the newborn will need to be done by cord blood samples or neonatal levels of the drugs and metabolites. So when would greater than minimal risk to the fetus be acceptable? Pregnant women can be enrolled in clinical trials that involve greater than minimal risk to the fetus if the trials offer the potential for direct clinical benefit to the enrolled pregnant women and or their fetuses. An example would be a drug or biologic that reduces the risk of acquiring a serious health condition. Currently, there's many studies being done on women who have HIV, and they're doing vaginal scrubs with chlorhexidines to decrease the exposure of HIV or herpes to the newborn. What about off-label use of drugs if the drug provides benefit to the pregnant women and the fetus? This is an optional discussion question, and I encourage you to take a look at this and try to find that drug that is currently being used for off-label use and why. We do use a lot of drugs off-label. There's just no clinical trials being done on pregnant women, but we know they work and they are effective, and they do have great effects, especially on the mother and the fetus. These are my references, and I'd like to discuss with you some presentation conclusions. Sometimes we feel like this dog at the end of these presentations, so I'm trying to just help you smile a little bit. What I'd like you to consider with these conclusions is that pregnant women are part of the vulnerable population, as well as in this presentation, the employees and the children. So until several decades ago, most researchers avoided using groups that fall under the rubric of vulnerable populations, since they were either difficult to access, too easy to assess, or were lacking in guidelines and were therefore ignored altogether or treated with disregard when included. Number 2, one of the essential reasons for including vulnerable populations in research is that significant harms may result if they are excluded. Effective results-driven research to improve population health requires the inclusion of diverse subpopulations. Thank you so much. This is our class discussion question that will be posted on Canvas, as well as the link to the article. I hope you've enjoyed our presentation, and we encourage your comments. Thank you so much.